My father's a very tall Irish man, and my mother is a very cute, tiny, petite little Hispanic woman. So my parents kind of combined, came together, and I was born, and then I got my father's nose, and I had a very bold, pronounced Irish nose, smack in the middle of my face, and I said, you know what? Got my mom's eyes, got my mom's hair, got my father's nose, and if I would have been his son, I think that would have been okay, but as his daughter, I was like, I think I need to do something about this. My name is Gloria, and I had revision rhinoplasty. A plastic surgeon did not perform my previous surgery. I came to find out later that it's an ENT. So like I had said previously, I didn't know that ENT doctors, ears, nose, and throat specialists can perform plastic surgery. He wasn't even a plastic surgeon. I wasn't happy with the results I got from the first surgery. So I knew I wanted to do it again, but I was afraid to, because you always think it's going to be worse, or this time it's really going to be bad. But what finally made me decide was I saw one of Dr. Motyke's shows on his Dr. 90210 show, and I saw one of his patients there who had a similar situation, and her results were wonderful, and that's what ultimately made my decision that I could go ahead and do it again. Well, the difference between the consultation with Dr. Motykie and the consultation with the first doctor, the ENT, was that the first doctor told me what he was going to do to improve my nose, and Dr. Motykie listened to my concerns. As a matter of fact, when I asked him, well, what do you think? He would say, well, it's not what I think, it's what do you think? And that made me feel really comfortable because he was listening to my concerns. He did show me what my results would be like with computer imaging, which was really, really cool because part of me was very, I even going through that experience, I was, and as comfortable as I felt with Dr. Motykie, you always have that little bit of that skepticism. And I thought, okay, I know he's going to do great, but will it actually look the way it does on the computerized image? And it did. Just the one thing or a couple of things I would say to patients who are going through the same experience would be to get informed, ask the right questions, and make sure that you're with a doctor that listens to your concerns. You're not there to have somebody, do an ultimate makeover of what they think you should look like. Your doctor should be your partner. I just feel really blessed and really lucky that I was able to find the right doctor. And that would be my biggest advice to give to everybody, is to speak to Dr. Motykie.